When you look at the benefits that the patients report about the Sentio, they say, well, it's very natural sounding. My ears are more in balance, or are in balance, so they have sound localization restored, and they're happy with the way things sound. The difference between the ears is minimal. So for an audiologist, that is the goal you want to achieve. When I look at patient success stories, I see that with the pure conductive hearing loss, they regain the functionality of one of their ears, which they haven't used in years for some people. One of my patients gave the feedback that she would expect Sentio to be an enhancement of her life, and afterwards, after she tested it and after she's used it for a couple of, almost 2 years, she said it's life-changing. She's a psychologist, and she had a lot of problems with hearing in noisy environments, and because her second ear, her bad ear, is almost restored to normal, she can now function in noisy environments. With bone conduction devices, there is always the risk of feedback issues. With Sentio, there's almost no instances of feedback. All of the patients are very happy with the design of the Sentio. It's a small processor on the head. A lot of people say, well, you don't see it beneath the hair. The design of the battery doors, for instance, is very, very nice. They're quite enthusiastic about the way it's built. The cases where a transcutaneous system would be preferable compared to a percutaneous system would be when people lack the dexterity to put the sound processor on the implant. People with skin problems, or people with maybe diabetes, with known risk factors for percutaneous implants. When I talk to my patients about fitting a bone conduction device, any bone conduction device, first and foremost I want to be sure that they're making an informed decision. I have to know what their needs are for the hearing, and I have to know that a bone conduction device meets their needs. So they have to test it with a soft band in their daily life, and we have to measure the benefit in the clinic. And with all those data, with all those experiences of those patients, we can make an informed decision from a broad spectrum of bone conduction devices, in which Sentio is one of them.